Patients have been going to the dentist to have a tooth filled for centuries. Over time, the restorative materials have changed, but one type that continues to be a strong choice is amalgam. Amalgams or silver fillings have been used for over 150 years. The ADA believes they are one of the most effective and affordable fillings available. Because of their durability, amalgams are the perfect filling for teeth that get the most wear and tear, like your back molars. Some critics have claimed that amalgams are unsafe. This is not true. A recent study by the Food and Drug Administration found no valid evidence that amalgams are unsafe. That's great news for patients and dentists alike. If you have any questions about amalgams, ask your dentist or go online at www.ada.org. For the ADA Dental Minute, I'm Dr. Maria Lopez Howell.
The ADA's message is simple, and it's been this for many, many years, and that is that amalgam is a safe and effective dental material that is absolutely crucial in restoring the damage that can be done from dental decay and disease in cavities. You know, we're not alone in this. Every major national and international health association agrees that amalgam is safe and effective. That includes the World Health Organization, the Centers for Disease Control, the National Institutes of Health, the American Association of Pediatrics, all believe, based on very, very sound scientific evidence, that amalgam is a safe and effective restorative material and an important choice for patients to have. In some cases, children, for example, have a very, very difficult time keeping still. People with special needs sometimes have very, very difficult time sitting in the dental chair. And sometimes amalgam is the only choice for them compared with the other options of sometimes even losing their teeth. It's durable, it's safe, it's effective in being placed in areas that are difficult to keep clean, in back teeth that have to withstand a lot of force and wear. The science hasn't changed. The science has been this way for decades. Unfortunately, there's some groups who don't accept the science, who like to rely on fear and other factors. And so, in light of that, I believe that the FDA has decided to convene an advisory panel to consider those voices, but the science hasn't changed, our view hasn't changed, the views of all of the world and international national health organizations concerning the safety of amalgam haven't changed. And, you know, frankly, the American Dental Association welcomes new looks at all of the dental restorative materials that we have, because our goal is to promote patient safety. What patient safety and science shows us, what science shows us now, is that patient safety is absolutely protected with dental amalgam material. Amalgam is not only safe and effective, but it's an extremely important option that patients should have. And if patients have questions about whether it's the right option for them, they should talk to their dentist about it, and also see ada.org, where there's lots of material to help make those choices.
For over 75 years, consumers and dental professionals have looked for the American Dental Association's seal of acceptance on products. The ADA seal stands for quality and effectiveness. Manufacturers who apply for the seal must meet certain criteria. They must provide objective data supporting the product's safety, evidence of purity and uniformity in manufacturing practices, and laboratory studies and clinical trials using guidelines set by the ADA to demonstrate effectiveness. All product claims made on packaging and labeling are approved by the ADA, so you can trust them. The seal is awarded for a 5-year period. These products are continually reevaluated to ensure safety and quality. To learn more and find a list of products awarded the ADA seal, visit ada.org. For the ADA Dental Minute, I'm Dr. Maria Lopez Howell.
Mr. Chairman, members of the committee, my name is Rod Mackert. I'm a dentist, I hold a PhD in materials science, and I'm a professor of dental materials at the Medical College of Georgia School of Dentistry, and a member of the ADA Council on Scientific Affairs. I speak on behalf of the more than 140,000 members of the ADA, the voice of more than 70% of the nation's dentists. I'm grateful for this opportunity to discuss dental amalgam, which increasingly is a subject of controversy, the discussion often marked by half-truths and misinformation. I want to begin by stating categorically that dental amalgam is a safe and effective treatment option for dental decay. I also want to clarify the ADA's role. It is not our intention to advocate one restorative material over another. We are here to attest to the safety of dental amalgam. Our purpose is also to help dentists and patients understand all of the appropriate treatment options that are available to fill cavities, to provide a scientific basis for professional choice of safe materials, and to defend the rights of dentists and their patients to make informed choices among those safe options. And the vast majority of American dentists support us in that purpose. The ADA wants dentists and patients to understand dental treatment. I call your attention to the chart on restorative materials that's in the materials that we've provided, which the ADA prepared to help dentists understand the various restorative options. Amalgam is by far the most thoroughly researched and tested restorative material among all those that we dentists use. That is why we oppose any legislative or regulatory action to limit its continued appropriate use. One of the principal difficulties in designing a study on low-dose neurological effects of any substance is identifying an appropriate control group. To be valid, such studies must compare apples to apples. In this light, a particularly important study population is that of the Swedish Adoption Twin Study of Aging, SATSA, conducted by the Karolinska Institute, which awards the Nobel Prize, which evaluated twins reared apart and controlled twins reared together. A total of 587 subjects with mean age of 66 years were studied. The authors concluded, quote, "This study does not indicate any negative effects from dental amalgam on physical or mental health or memory functions in the general population over 50 years of age." A 1998 multi-center study by Melkart and colleagues examined 4,787 patients to determine whether there is a difference in symptoms between patients with and without amalgam fillings. They concluded, quote, "Based on the present results, the first question of the study, whether patients with amalgam fillings differ from patients without amalgam fillings in regard to clinical symptoms, has to be answered with a clear no. Additionally, there was no quantitatively accessible relationship between the presence or intensity of special symptoms and the number of amalgam surfaces," end quote. Many other human studies have investigated the possible relationship between dental amalgam and Alzheimer's disease, multiple sclerosis, adverse pregnancy outcomes, reduced immune competence, impaired kidney function, or other adverse health effects, and they have found none. This is not to say that we consider the book closed. Significant research about dental amalgam is ongoing, most notably 2 major studies supported by the National Institute of Dental and Craniofacial Research, which you will hear about from the next panel. We enthusiastically support these efforts and any other legitimate research that deepens our understanding of the science behind dental practice. Simply put, mercury and dental amalgam are very different substances, and using the terms interchangeably is misleading. When mercury is mixed with other metals such as silver, copper, and tin, it forms intermetallic compounds that behave completely differently from liquid mercury. The ADA is not alone in its position that dental amalgam is safe and effective. The National Institutes of Health, the U.S. Public Health Service, the Centers for Disease Control and Prevention, the Food and Drug Administration, and the World Health Organization, among others, have independently reached the same conclusion. The Alzheimer's Association, the National Multiple Sclerosis Society, and the American Academy of Pediatrics all have explicitly stated that there is no scientific evidence linking dental amalgam with any known disease or syndrome that these groups track. These organizations exist to understand these diseases and to advocate for those who suffer with them. They would not put their reputations and the safety of their members on the line if they did not agree with the majority of the scientific community that dental amalgam is safe. Dentists use amalgam because it is durable and easy to handle, and therefore particularly useful for large fillings in back teeth in which bite pressure is greatest. It is especially valuable for treating children and some disabled patients who have difficulty keeping still because it can be placed quickly and doesn't require a perfectly dry environment. Any dentist who has placed a good filling in a moving 3-year-old can tell you how important this is. It should go without saying that if we doubted the safety of amalgam, its qualities, durability, ease of use, and cost effectiveness wouldn't matter, but this is not the case. Dental amalgam is safe. We are greatly concerned that emotionally and scientifically invalid reports about amalgam are confusing and even alarming people to the point where they will not seek necessary dental care. Postponing needed care only ensures that the problem will get worse. Mr. Chairman, amalgam fillings are no threat to patients. The real danger is untreated dental disease. Amalgam is an excellent material, albeit only one of many, in our fight against dental disease. We urge you to consider only valid scientific information and take no action that would rob us and our patients of this valuable, safe, and effective therapy.
Thank you, Doctor.
Charlton, and I'm a general dentist practicing in Sandy Lake, Pennsylvania. And I am president-elect of the Pennsylvania Dental Association. I'm here today to testify on behalf of more than 5,500 members of the PDA. It should be clearly understood that amalgam is one of the most commonly used tooth filling materials, and it is safe and effective treatment for tooth decay. Amalgam has been used as a filling material dating back to the 19th century, with millions of patients around the world who have experienced no adverse effects from being exposed to it. Despite its long history of effectiveness, dental amalgam has stirred controversy due to its mercury content. Now, I was a chemistry major in undergraduate school, and the basic principles of chemistry have not changed, even though it's been quite some time since I was an undergraduate. The mercury in silver-colored restorations is bound in a molecular form in much the same manner as elemental chlorine gas is bound in the molecule sodium chloride. And I'm sure most of you realize sodium chloride is simple table salt and that chlorine gas is poisonous. The molecular combination of sodium and chloride makes it safe to be used in cooking and as a table spice. It is safe, it's plentiful, and it's been used for a lot longer than silver-colored amalgam. Mercury levels from dental amalgam have been extensively studied, and based on generally accepted estimates of exposure by Olson and Bergman, a person with an average of 13 amalgam restorations would be exposed to 1 to 3 micrograms of mercury vapor per day. Using the same model, Olson and Bergman, the World Health Organization the level associated with the most subtle adverse effects would require nearly 500 amalgam surfaces to produce even a noticeable side effect. In the United States, the general population has an average mercury level 10 times lower than the World Health Organization's level of concern. Reports that suggested mercury from dental amalgam causes Alzheimer's or multiple sclerosis are knocked back by scientific evidence. The Alzheimer's Association states on their website, according to the best available scientific evidence, there is no relationship between silver dental fillings and Alzheimer's. And additionally, the National Multiple Sclerosis Society states on their website, there is no scientific evidence to connect the development of MS or other neurological diseases with dental fillings containing mercury. The FDA recently reviewed the scientific evidence on dental amalgam and in July of 2009 classified dental amalgam as a Class II medical device, the same as other commonly used dental restorative materials such as composite and gold. There's been no comprehensive study done to date to warrant overturning of that decision on the safety of dental amalgam. Studies upon studies have been done over many years to dispute the argument that amalgam is a safe material to use, and time again the studies have concluded that dental amalgam produces no harmful side effects. Thank you for allowing me the opportunity to speak to you today on the use of mercury in dentistry, the important issues pertaining to patient safety, and the science behind dental amalgam, and I would be happy to answer any questions.